when they talked about the pooled analysis and also the open label data, obviously one of the biggest concerns we have in chronic diseases is long-term treatment, and safety over a period of time can change with drugs. We've seen this. So these pooled analysis and looking over a longer period of time become very crucial in a disease like NMO spectrum disorder, where patients can be treated for sometimes many decades to prevent them from getting worse. So it was very important, and I think very satisfying to see over that period of time that the open label data didn't show any new signals in terms of safety, that actually in some cases the placebo group did worse than the Satralizumab group. And the other part that I think is very important when we go over the 96-week up to the 144 weeks is that the efficacy continued as well too. So you see that the patients who had been on placebo had increasing relapse rates, whereas people on Satralizumab continued to be very, very stable over that period of time. So I think it comes back to, you know, when we're looking at patient populations like chronic disease and serious disease like NMO, we always want to make sure benefit risk is very, very good, and Genentech is dedicated to follow these patients for a very long period of time to ensure that there's no new signals, and also do other research to make sure that we fully understand what's going on with the immune system and the disease and the drug over that period of time. So I think the data is very exciting, considering, you know, as I said before, nobody likes surprises. And as I said, you know, sometimes it's not exciting data, but it is actually very exciting data to neurologists and to patients. So no news is good news, and I think this, you know, the open label data being, particularly the safety side, the efficacy being maintained, but the safety is really quite crucial when we're, you know, changing things in the immune system. I think there's two things, is when we talk about mechanism of action, when we treat a drug, we're assuming that, you know, things don't change in the immune system. So I think this really comes back to IL-6 being a very important component over a very long period of time as well too. So I think that's one of the major portions. It also, again, drugs can change, other parts of the immune system can change safety outcomes. So again, that becomes, that longer term data is very, very crucial, because when you change the immune system, then you can get surprises. I think the other important part about the data is the data in the adolescents as well too, because as you know, they can have more severe disease, their relapses can be worse, and when you're that young, obviously quality of life can go down quite a bit. So the fact that we saw no problems with safety in those patients and continue to see efficacy, even though it was a small portion, I think that's very crucial, because we really have no data in adolescents otherwise in this disease that's been in a controlled fashion.